Hey, it's Dr. Caleb Donnell from Donnell Chiropractic, and it's time to have the vitamin D talk. If you live in Michigan like I do, you may have started to notice that you don't see the sun nearly as often as you used to, and we haven't even hit the time change yet. So, what does that mean? It means we're not soaking up those rays from the sun so that our bodies can make vitamin D. We need to start supplementing with vitamin D this time of year, all the way through about April. So what does vitamin D do for us? Vitamin D helps absorb calcium and phosphorus into our bones. Okay, that's most frequently what we think of when we think of vitamin D. It also helps our immune systems fight off things. So being that it's flu season, cold season, that type of thing, it's also a good idea to start taking some of those. Vitamin D has been researched quite a bit this last decade. We're finding out that it does a lot more for us than we first thought, mentioning those first couple things. They're actually finding that it can help prevent heart disease, helps fight depression, especially seasonal depression in the wintertime, anxiety, lots of different things. So if you want to do some research on it, just type it in, vitamin D, and you'll start to see all those things. Now to go along with that, the government suggests for a daily recommended dose of getting about 400 to 600 international units is what they call it per day. If you look at independent researchers, they're actually saying you need to take much, much more than that. They are actually recommending about 2,000 a day. So it depends on who you talk to, but I think the government's pretty low on that recommendation, especially since we're not getting it from the outside sources, and that they're finding out that it actually plays an important role in over 2,000 of our genes. So vitamin D is very important, more important than we used to think it was. Couple choices that I keep here in the office. I like Standard Process's Cataplex D. Okay, that's a typical supplement form, just something you swallow. You take 2 per day and it gets you 1,600 international units. But something I've come across more recently is something from Biotics Research. And it's kind of unique. It's called their Biodemulsion Forte. Okay, they make a biodemulsion, and the biodemulsion gives you 400 per drop. So this is in drop form. Okay, it's already a liquid, which means you absorb it much more readily than a pill form. So you basically put 1 drop on your tongue, and it gives you 400. But the Forte actually comes with 2,000 international units per drop. So it's very easy. You just put that drop right on your tongue and you're good to go for the day. So let me know if you're interested in something like this or if you have any more questions on vitamin D. Until then, have a good time.